Here I am, and I never knew breaking the myths is going to be this difficult. But nevertheless, I believe I'm going to finish in time, and it's going to be a very interesting kind of a talk. So just bear with me for the next 8 minutes. So just quickly going through what the data says. According to WHO, in 2020, there were 2.3 million women diagnosed with breast cancer and around 6,85,000 deaths which happened worldwide. By the end of 2020, there were around 7.8 million women alive who were diagnosed with breast cancer in the past 5 years, making it the world's most prevalent cancer. According to CDC, around 2,300 new cases of male breast cancer was found in 2017, and out of them 500 died. According to Ministry of Health and Family Welfare, more than 2 lakh women in India were diagnosed with breast cancer in 2020, and nearly 4 out of 10 women diagnosed with breast cancer succumbed to the disease. As per 2020 National Cancer Registry Program report, the number is expected to rise to more than 2.3 lakh cases by the end of 2025. And a very recent data that was shared in Lok Sabha response on July 22nd this year, they said that the highest age-adjusted rate for breast cancer incidence was found in Kerala, Punjab, Andhra Pradesh, Karnataka and Telangana in 2020. Out of this, Kerala having the highest of 45.7. So this is how the breast cancer global mortality looks like. Around 30% of them die worldwide, and 34% is the ratio in Asia. So this is a very common myth, finding a lump in the breast and they say it could be cancer. So these are the various cancer symptoms, being the lump in the breast and also a lump in the armpit being the most commonest. So Dr. Ziedman says if we diagnose and treat a breast cancer while it is in stage 1, survival approaches around 100%. Survival drops as the stage advances. In fact, the cancer may never be palpable and still spread to the other parts of the body. So what do? Take charge, do a self-breast examination. Though only a small percentage of breast lumps turn out to be cancerous, but if you discover a persistent lump, please go and see your doctor. Or else, if you notice any kind of change in the breast tissue, or you see a secretion or anything abnormal which you've not been noticing in the past some time, please go and see your physician. That is the dictum we have to convey to the patients. Getting an annual clinical breast exam and also scheduling your routine screening mammograms is a must. Breast cancer doesn't always cause a lump, we know that. And by the time it does, the cancer might have already moved on. Men do not get breast cancer. Do you really feel so? Breast cancer in men is usually detected as a hard lump underneath the nipple and areola. Men carry a very high mortality rate. Why? Because awareness among men is much less and they are less likely to catch a lump or a noticeable abnormality in the breast. Men are diagnosed with breast cancer rarely. The most common risk factors is a family history of breast cancer. And the BRCA2 genetic mutation markedly increased the risk of breast cancer in males who carry this gene. These are the various risk factors for breast cancer in males. And these are the facts about male breast cancer. Look out for the lumps. If there is a genetic mutation, please be more cautious. Estrogen boosting health conditions, advancing age as it is in women, and also distinguish between lump and gynecomastia. A mammogram can cause or spread breast cancer. I think all of us gynecologists do not feel so, but then still it is a very widespread myth. A mammogram of the breast absolutely does not cause or spread breast cancer. It is the gold standard for early detection of breast cancer. And also we need to note that the breast compression that happens during the mammogram will not spread it. The standard recommendation for an annual mammographic screening for women begins at 40 years. So if you have a family history of breast cancer, you are likely to develop. That is what most of us tell our patients too. Or, no one in my family had breast cancer, so how do I? So many people think that breast cancer as an inherited disease, but you'll be surprised only 5 to 10% of these cancers are believed to be hereditary. Majority of people who get breast cancer have no family history, suggesting other factors like, lifestyle, environment. So around 85% women who were diagnosed did not have a positive family history. The biggest risk factor, I would say, is being a woman and growing older, as all of us are. So while women who have a family history of breast cancer are at higher risk, most women who have breast cancer have no family history. Now, if you have a first-degree relative with breast cancer, like if you have a mother, daughter, or a sister who developed breast cancer at less than 50 years of age, you should consider some form of breast imaging, maybe a BRCA gene testing, 10 years before the age of the relative's diagnosis. Now, if you have a second degree relative with breast cancer like your dadi, nani, masi or bua, so in those patients your risk increases slightly, but it is not same risk as the previous category. Now, if you have multiple generations diagnosed with breast cancer on the same side of the family, like maybe your father's side or your mom's side, so these there are several individuals who are your first degree relatives, and they have been diagnosed with breast cancer. So again, the risk is much more. So if this is your case, so we would recommend getting your BRCA gene testing done 10 years before the diagnosis of the relative. So every woman starting at 40 years of age should have a yearly mammogram done, regardless of the family history. Those women with family history of breast or ovarian CAs should be evaluated by a genetic counselor at 30 years of age. And this group of women may need to begin breast cancer screening prior to 40 years. So if the gene mutation BRCA1 or 2 is detected in your DNA, you will definitely develop breast cancer. Do you really feel so? This is again a myth. According to National Cancer Institute, regarding families who are known to carry BRCA1 and 2, not every woman in such families carries a harmful gene. And not every cancer in such families is linked to a harmful mutation of one of these genes. Furthermore, not every woman who has a harmful BRCA1 and 2 mutation will develop breast or ovarian cancer, but a woman who has inherited a harmful mutation in BRCA1 or 2 is about 5 times more likely to develop breast cancer than a woman who does not have such a mutation. So mutated BRCA1, there is about a 55 to 65% chance of developing breast cancer once in a lifetime. If you have a mutated BRCA2, it is about 45%, and with the normal BRCA, still you have a 12% chance. Breast cancer is contagious. Breast cancer, we know, just not breast cancer, any cancer is a result of uncontrolled cell growth of mutated cells that begins to spread to other tissues. So you cannot catch breast cancer or transfer it to someone else, provided you have a healthy lifestyle and you are not, having any of the risk factors. Antiperspirants, deodorants, or some people say using anti-tanning creams also causes breast cancer. There is no such evidence in connection to this. However, I feel that there are a lot of rumors, that are spread, especially with the antiperspirants which contain aluminium and other chemicals. They say that, maybe it is absorbed through the lymph nodes and then they make way to the breast cell, which I somehow do not believe, and even the data does not support that. And some people even say that when you're shaving or waxing the underarm area and then you're using antiperspirants, probably you're creating tiny holes and you create the way to reach the breast tissue. It really isn't that the case, So the researchers at National Cancer Institute feel that there is no conclusive evidence linking the use of underarm deodorants, antiperspirants, and subsequent development of breast carcinoma. A breast injury may be the cause of breast cancer. So injuries usually, it causes changes, it causes fat necrosis in the breast tissue. So maybe on a mammogram, it might just mimic, one of those cancers. So maybe you have an irregular mass with some jagged edges. So maybe the radiologist gives a query report. But the best way to do is do a needle biopsy and you'll be sure it isn't. Wearing underwired bras increase the risk of breast cancer. There is no evidence, trust me, and it is all the media coverage and internet that have fueled numerous myths supporting this. Trust me, it doesn't work like that. 2014 study was done. Around 1,500 women with breast cancer had found no link between bra wearing and the non-wearing ones. The wire might irritate the skin and it might lead to some skin breakdown and might cause some infection, but not cancer. IVF, all my fertility friends, feel that, come on, we just do not want to believe this, and this isn't true. So a recent meta-analysis of all the observational studies over past 30 years concluded that there is no increase in breast cancer risk for women who received ovarian stimulation drugs as compared to the normal population. So breast cancer happens to older adults. I think Dr. Sushila covered in her talk that it isn't so. So while it is true that, being a woman and getting older is a risk factor, the average age of a new breast cancer diagnosis is around 61 years, but it can occur much earlier. About 5% of these breast cancer diagnoses are in women less than 40 years of age, and what is important to notice, they all have a very strong family history. In 2017, about 4% of invasive breast cancers were diagnosed in women less than 40 years, while about 23% were in women in 50s and 27% in their 60s. So, regardless of the age, all women need to do a self-breast examination, get an annual mammogram done, and if you are at risk, and you don't know what to do, please go and see your physicians, your gynecologists. So if you have a significant lifetime breast cancer risk based on a strong family history, then you may qualify for genetic testing and early screening at the age of 25. I think somebody in the crowd asked that, what is the right age to get a mammogram done? So in case there is a family history, there is no problem in getting the mammogram done even at 25 years of age. It is just like an X-ray, so it is not going to harm her. Carrying a phone in your bra can cause cancer. There is no evidence to support this, that cell phones can cause cancer, especially the breast cancer. Again, it is the media reports that have raised concerns that carrying a cell phone in your bra might increase the cancer risk. So what they feel is that, it is basically the radio frequency radiation given off by the cell phone that is increasing the risk of brain tumors. So similarly, it might increase breast cancer, but it is not so. And what my question is, why can't you just put your phone in the bag or on the table or elsewhere? Why do you have to put it in the bra? I'll just take a minute more. So these days, with the younger women, with the generation next, we have nipple piercings coming up, and they do not increase cancer risk. Yes, they might lead to complications because of injury, because of infection, abscess, difficulty in breastfeeding due to blocked ducts, but they would not cause breast cancer. Oh my God, everything these days is linked to sugars. So, anything happening under the sky, we feel is happening because of increased sugar. But not breast cancer. So while discussing sugar, it is worth busting a related myth that sugar helps tumors grow. This myth arose because cancer cells divide rapidly and therefore they need a lot of energy. So, we feel that whatever needs a lot of energy, so sugars are giving energy and the cancer cells will grow, which is not the case. So it's again a myth. If you maintain a healthy weight, exercise regularly, eat healthy, limit alcohol, you just do not have to worry. Is it so? Yes, there is evidence that all these behaviors can lower your risk. However, they will never guarantee that you will not get the disease. So, if you have a healthy nut friend, like I have so many, who think they are fit and fab and they're never going to get the breast cancer, so it is a myth. Everybody, each one of us sitting here is at risk, so we better get investigated. Annual mammograms guarantee that breast cancer will be found early. Although it is the best early detection tool that we have, but it does not always find breast cancer at early stages. So if you say there is a false negative result, meaning that the images look normal even though there is some evidence of cancer that is present. So it is more common in younger women who have denser breasts, they have more connective tissue, they're more youthful, less fatty tissue. So maybe in those cases it could be missed. So there is about a 20% chance of women having breast cancer and having been missed on mammograms. So perform monthly breast self-examination, have a physical examination of the breast every year. Just the last. So when treatment is over, you're finished with breast cancer. That is all we want to believe. But there is a long-term impact on people's lives and well-being. And people with breast cancer often report, that they have to go through a lot of radiation, a lot of chemos, and surgical complications. It just doesn't end there. In reality, there are targeted therapies, that happen every year. And probably there are hormonal therapies they have to undergo. And if they decide to get the breast reconstructed, it's again several surgeries that a woman goes through. And for those with metastatic cancers, it's probably going to last their entire life. So it just doesn't end there. So be empathetic. So early detection saves lives, and hashtag detect to protect. That is what is the take-home message today. And thank you. We are all fighting for it and living with hope.